All right. Well, again, welcome everyone. We're here to discuss the individual placement and support and IPS overview for you all as DRCs. And what we're going to cover today are the objectives of the training. Employment is a big deal. Employment first, a national movement explained. Talk a little bit about and really walk you through what is IPS. Tell you about the IPS learning community, the foundational beliefs of IPS, the 8 principles of what IPS is, and of course, how disability resource coordinators can work and utilize the IPS principles in each of your roles. So, the purpose of us delivering this IPS training to all of our disability resource coordinator partners is to provide you the context on how IPS and Employment First can help all of you do your jobs. And we know that you're doing a great job, so this is informational, and we want to show you what these principles are. So, we really would want you to have an understanding of how these principles of IPS and the Employment First can be implemented into your work. And you'll be able to specifically know how to implement the IPS principles through your integrated resource teams. So, employment is a big deal. And why is employment such a big deal? Employment is such a big deal because we believe employment is recovery. And it's been shown that the lack of employment is a key social determinant of health, as is poverty. And both of those situations lead to poor health outcomes for people. And we really want to, share a belief that, a life on public benefits is a life of poverty and lessen health outcomes for folks. So employment and working is really part of the recovery process and something we all strive to do and help folks obtain. So we've also seen research that, the low employment rates, they're pervasive for people with disabilities. And those compounding effects are more significant than that of their non-disabled, unemployed peers. So what will help improve employment outcomes? It would be all of us, weaving the employment principles and the practices into our day-to-day service delivery, demystifying and normalizing that employment conversation. And so we're going to talk about how the employment first executive order is going to help with demystifying, helping everyone from leadership down, having the language to be able to help people with disabilities find and keep employment. So, Employment First as a national movement. Employment First is a national systems change framework. It's centered on the premise that all individuals, including those with the most significant disabilities, are capable of full participation in competitive, integrated employment and community life. So, in practice, really what this means is that competitive integrated employment is considered as the first option and preferred outcome in planning and the delivery of services and supports to New Yorkers who are of working age. And in this slide, we've included additional information on Employment First. So, what else does Employment First include? This includes and acknowledges that our service system has not historically been good at prioritizing or really understanding the benefit of employment, and in fact, has been often a big part of the problem. And we want to share, though, that part of these employment first principles are that disability in no way diminishes the rights of people to live independently in their community. The principle that dignified workforce participation is a fundamental aspect of a life for people with and without disabilities. And people with disabilities, including those with the most significant disabilities, can obtain competitive integrated employment within the general workforce. So, really not separating them into jobs just for individuals with disabilities, but in the community, working right alongside people with or without disabilities. And that being said, its competitive integrated employment is the intended and expected outcome for all working age New Yorkers with disabilities. All students with disabilities should receive the education, training, and services necessary to achieve competitive integrated employment as adults. In person centered planning and valuing of the individual choices are priorities and should be incorporated into our policies, our program designs, the implementation, and service delivery. In the workforce, it should reflect the diverse makeup of our community in which it resides. And public awareness of the value of employing people with disabilities should be increased, including engagement with the New York business community. So, a lot of these employment first principles, each of you are already doing, and we wanted to provide this information to you and let everyone know that as a state, we are definitely moving to have employment as a primary outcome. So, additional principles are working with the individual, like having informed choice, the respect for privacy and confidentiality, providing the availability and assistive technology to help them with employment, and inclusion of evidence based practices in the pursuit of competitive integrated employment is essential. And what we're going to talk about a little later is the IPS, which is an evidence based practice, and how that will apply and be weaved within these principles. Also, another principle is people with disabilities receiving public benefits should be supported in an effort to work toward financial independence. Real big. I know each of you um, are able to provide benefits counseling and advisement, and that really helps toward increasing people's financial literacy. So, what is individual placement and support? So, a little bit about the history of IPS. It was Deborah Becker, and she's a certified rehabilitation counselor, and Robert Drake. He was a professor of psychiatry for the Dartmouth Medical School. They developed IPS way back in the 90s, and it's based on 8 principles. And we were going to be going over each of these principles during this presentation. So, like I said, it began back in the 90s, and back then that was a time when really the dominant approach for helping people with disabilities find employment was kind of a train them place. There was a real big emphasis on a lot of thought that people needed training and assessments before going to work. So some of the IPS principles were very revolutionary during that time. We have included here lots of great information when you go to these links, where if you would like to and have time to learn much more about the IPS model, we've included where you can get additional and more in-depth training on it, and hopefully you will have a chance to take a look at it. So, what is the model of IPS in support of employment? So, it's obviously a model for competitive integrated employment. It's for putting people in the community, again, working right alongside people with or without disabilities. And it was really focused on helping people with serious mental illness find those jobs. It is an evidence based practice. is based on a place and train support, meaning help them get into the job and then wrap the supports and training around them. And it is based on 8 basic principles. So what we want to share is that IPS is not just in New York. IPS has a learning community. And in fact, over the past 3 decades, it's really emerged as a robust evidence-based approach to helping people with mental illness to succeed in competitive employment. And it helps people living with these behavioral health conditions work at regular jobs of their choosing. And it's grown tremendously over the last 30 years. It started back again in New Hampshire in the 90s, and now it's grown into an international community. And that encompasses 27 US states and 7 countries worldwide. They have adopted and are implementing these principles. And to show you what that kind of looks like, we've included a map of the United States and all the different states that are using it and the different countries. So that's a little bit about the overview of Employment First and the IPS principles. And I'm going to pass this over now to my partner, Chris, and he's going to cover the foundational beliefs of what IPS is. So, Chris, there you go.
If I could jump in for just a second, there is a question in the chat. How does pre-vocational training and the IPS model interact?
So I'd like to clarify when we say pre-vocational training. So IPS believes on working with the individual and Chris will go through these principles in a little bit, but working with the individual, talking to them about what their preferences are, what their abilities are, what their skills are, going out into the community and connecting with employers. So there really isn't a lot of pre-vocational services being provided in IPS. You know, IPS is really looking to be in the community as soon as possible.
Yeah, thanks, Jennifer. And that's a great question. I think to build on that, IPS is that, place then train approach as opposed to the train and wait, right? And then place. So, pre-voc, certainly there's planning and training involved in IPS, and you'll see that in a minute with the principles. But we do believe in a rapid job search approach where we capitalize on the person's interest at the moment, and then whatever supports they need on the job will be provided to them as needed for as long as they need them. So it'll kind of be a little clearer as I go through the principles, but great question. Keep them coming. I'm going to talk about the foundational beliefs of IPS. We can go to the next slide, Jennifer, please.
You got it.
So this is kind of the paradigm that we're operating within, right? So the foundational beliefs of IPS is that we know that work is an essential part of recovery. So recovery being mental health recovery, substance use recovery. We know that work is that intervention that increases the individual's quality of life, okay? Being productive, as we all know, is a basic human need, right? We need to have a purpose in life. We need to be validated, right? Working can also be a way out of poverty. We have a little more jingle in our pocket when we're working, right? That's a way to increase, again, our quality of life, our options financially. It's a way to, we call it thriving as opposed to surviving. You all talk to folks who are receiving public benefits all the time, SSI, SSDI, Medicaid, Medicare, the whole gamut of public benefits. We know that folks are living check to check, right? We want folks to be as productive and have as high a quality of life as possible. So we know that working is a way out of poverty. Working is also excuse me, a social determinant of health. That's a phrase that you've probably heard many times over the past few years. Social determinant of health really is a non-medical factor that influences the health outcomes of individuals. So where they live, right? Are they working? Do they have access to quality transportation, quality food, all of that? Today we're talking about, are they competitively and integratively employed, right? So that has a direct effect on people's health, physical health, mental health, emotional well-being, right? Competitive employment has a positive impact on self-esteem, life satisfaction, and reducing symptoms. IPS is not something that we just think is a good idea. It is an evidence-based practice, as Jennifer mentioned a minute ago. We have the data that says that folks who are dealing with mental health symptoms, once they start working in a competitive integrated environment, have a reduction in symptoms, have a reduction in the need for clinical interventions, right? Have a higher quality of life because of the work they're doing. So again, work you're already probably doing, as Jennifer also mentioned, so thank you again for what you're doing, but we just want to highlight what the foundational beliefs are to remind you of the good work that you are doing. So, next slide. All right, so as Jennifer mentioned, there are 8 principles of IPS, and I'm going to go through those in a little deeper dive, but here are the list of those 8 principles. You've heard it a few times now, and these are not in rank order. These are just in order that we put them on the slide. Competitive integrated employment is the goal, right? We don't want folks working in sheltered work, secluded or segregated from the general population, right? Zero exclusion, attention to individuals' preferences, targeted systemic job development, rapid job search, right? We don't want to wait. We don't want to wait for folks to be ready, quote unquote, that we deem them ready. Integration with mental health treatment. We know that vocational services should not live on an island by themselves. We should be talking to the treatment team about work. Individualized time and limited supports, and of course, benefits planning, near and dear to the DRC heart. So we'll talk about that in a little greater detail in a few minutes. So next slide, please. Okay, so deeper dive into the 8 principles here. Competitive integrated employment, right? So we know the goal is to obtain any job related to the person's interests and abilities in the open labor market that anyone can apply for, right? So anyone being any member of the public can apply for and be paid the same as others in a similar position, okay? So competitively paid, integrated with others, with or without a disability, okay? And at least minimum wage should be the wage that they're earning. This includes part-time work or full-time work. Again, individuals working in those community jobs are working alongside members of the public with or without disabilities, again, as opposed to those sheltered work environments of the past, right? So sheltered work, as we know, was usually entry-level work that was reserved for people with disabilities that were, isolated, segregated from the public, often working for very little money or much lower than minimum wage, right? Doing kind of more rote work, right? And it usually was done in a way that did not take into consideration the individual's preferences, right? Which is what I'm going to talk about in a minute. So competitive integrated employment, CIE, that is the goal. Okay, next slide. Zero exclusion. Individuals are not excluded based on diagnosis, based on symptoms or recent hospitalizations, right? Having depression should not exclude someone from having the opportunity to work. Having schizophrenia, active schizophrenic symptoms should not exclude someone from having the opportunity to work. I only give those 2 quick examples because those are real life examples of folks who I have worked with side by side who rocked their work, who did a great job in that workplace. Individuals are not excluded based on substance use history, level of disability, legal system involvement, or homelessness, right? We know that work, again, is that recovery tool. We see work as a way for folks to get out of that homeless situation, to navigate that legal system involvement, to have a higher quality of life, right? Eligibility is based on individual's choice rather than being work ready. Again, the individual is the captain of their ship, right? We're here to support them. Okay, next slide, please. So again, speaking of the captain of your own ship, here it is. Attention to individual preferences, right? So services align with the individual's choices rather than our judgment or the practitioner's judgment. Job search is based on specific preferences, strengths, and work experience of the individual, not on a pool of jobs that are readily available. And I've seen that happen many times, right? We have a position at the local supermarket. Chris, we know you don't like working at the local supermarket, but that's what we have available. What are the odds that Chris is going to be successful at that job, right? Probably not great. But if I have a say in what I want to do, odds are I'm going to be more successful. The individual indicates their desired job type, right? Work hours and job supports if needed. Next slide. Targeted systematic job development, another principle of IPS. So employment specialists systematically visit employers. They're out in the community, as Jennifer mentioned earlier. They're not sitting in an office kind of just checking boxes, right? They're making connections, they're building trusts, they're decreasing stigma with the public, right? So employment specialists are visiting employers who are selected based on the individual's preferences, again, to learn more about their business needs and their hiring preferences, right? Often this involves multiple visits that are made to the same employers to develop those relationships, to develop that trust, right? Let me just pause because I do see a question from Lindsay. I got to get my screen out of the way. Okay, so Lindsay says, is there any data on how the stress of starting a job could create the opposite effect on the individual, i.e. exacerbating mental health symptoms? Yeah, great question. So Lindsay, I don't have the data at hand right now, but here's what I would say to that. And you'll hear this from the IPS team. So we often say, you know, if you think working is stressful, try poverty, right? Try living paycheck, not even paycheck, try living benefit check to benefit check, knowing that, you know, your existence is contingent upon the money you receive every month via public benefits, right? Can a job be stressful? Of course it can. We can all attest to that. But that's why there's time unlimited supports for folks who need it, okay? That's why there's not a cutoff after 30, 60, 90 days, whatever it is, that says, okay, Chris, we know that this is stressful. There's some anxiety going on here. Good luck. No, that's not IPS. That's not how it works. Your question is a great one because we're not so naive to say, well, you know, people are just going to work, they're going to do great. Yeah, of course, there's stress, right? Does it exacerbate symptoms? I have not seen that data. I don't have that data readily available, but what I do have is data that points to the effectiveness of employment as a key clinical intervention in helping people minimize and lessen the need for clinical mental health interventions. Their symptoms actually decrease and go down from the work they're doing, okay? Is that a perfectly paved road to that? No. But again, that's why there's supports available. So, Jennifer, just chime in if you have anything to add. I want to make sure that we get a good answer, a great answer, not a good answer.
I think that was great. I think it explained it. I think there was an additional comment in the chat about that there's all sorts of stress, positive and negative stress. I couldn't quite see it. It went real quick across my screen. Are you able to see that, Chris?
Yep. Yeah. So Adele, another great question. So any change can cause stress, even positive changes. Correct. You're right. Yeah. Change is scary, right? It's not just stuff in a vending machine that you get. It's scary stuff, you know? And so positive change could be scary, but we want folks to realize that through work and through their experience, they're able to navigate that, right? We're building resiliency, right? If there's one thing we've learned, and I'm going off script here, but I will say this. If there's one thing we learned about the COVID pandemic and isolation is that it only exacerbated a lot of symptoms for people that were already dealing with situations. Not for everybody, but for a lot of folks, right? We saw mental health symptoms rise dramatically during the lockdowns and during isolation, right? It had to be done because that was a public health issue. But my point in saying that is that, you know, we want folks to make that leap of faith and get out and work, right? Because isolation and segregation, we know is not good for health. We know that competitive integrated employment is good, and we have the data to back it up. Again, it's not something that we think is a good idea. It's something that we have numbers on that prove that it is a good idea. I'm gonna look at the chat here. So another great question here. I also wonder about people with specific triggers, such as individuals living with PTSD or TBI, traumatic brain injury, if there aren't assessments done pre-employment. Exactly. So Daniel, that's a great question. That's why employment specialists should never live on an island by themselves. That's why employment specialists should always be talking to the treatment team, right? That's why employment specialists should be talking to psychiatrists, social workers, to therapists, clinicians, whoever they are, right? As a way to navigate those triggers. Or if we know that it's a real heavy situation, a heavy trigger, let's talk about another way to help that individual. Again, he's the captain, he, she, they are the captain of their ship, right? Let's talk about another way to help them navigate the work that they want to do. Okay, we don't want to set people up for dealing with more trauma on the job. That's not the idea of IPS. It's how do we identify triggers, but how do we work within that framework of what the individual wants to do based on their strengths, right? Based on their experience, based on their skill set. What can we do to elevate that individual's opportunities to be successful on the job, right? Amanda says, I had those same thoughts, but around rapid employment. I'll wait till we get to that section. Okay. Adele says, the benefits at work far outweigh by far not being involved with the world of work. Thanks, Adele. I appreciate that, right? So the benefits of work far outweigh by far not being involved with the world of work. That's what I was trying to say earlier. But these are real world questions. So we appreciate this, right? We realize that IPS isn't evidence-based. It's an evidence-based practice. It has the data to prove it, but we also realize that it's not a perfectly paved road to get people competitively, integratively employed, okay? But the data does suggest that the folks who are working have a much greater quality of life, higher quality of life, and do not need clinical interventions as much as folks who are not working. That's just what the data says. So, but these are great. This is why we're doing this training. So please keep them coming. Again, Jennifer, anything you want to add, let me know.
No, I think that is fantastic, and it's a really good segue to the next principle of what the rapid job search is.
Okay, let's go. Okay, so rapid job search. This doesn't mean that if I'm an individual with a mental health issue and I say I want to work, we're going to go pound on a door today. What it does mean is that we're not going to wait though, right? If I'm interested in working today, we're going to capitalize on my interests, right? Whether or not I'm showing symptoms of mental health issues. It might mean we start today, right? But it means that we're not going to wait. So let me read the bullets here. Employment specialists help individuals obtain jobs rather than spending time with assessments, training, and counseling. So again, there was a question in chat about assessments, right? We know that some assessments need to happen, right? We're not anti-assessment.
He doesn't qualify anyway.
Let me make sure folks are muted. Hang on a second here.
Because we don't pay.
I got it, Jennifer. I was gonna find it. There we go. Okay. Sorry about that, everybody. We know we're not anti-assessment. We know that assessments are needed, right? Again, that's why the employment specialist is working with the treatment team to identify the individual's strengths and interests based on their experience. But we're not solely relying on those assessments to inform the job opportunities for that individual, right? So employment specialists are helping individuals obtain jobs based on what we have, but we're not spending an inordinate amount of time using those assessments and training and counseling to inform their opportunities. Okay, questions on that, just put them in chat. But that's really what we're saying here with Rapid Job Search, right? The first face-to-face contact with the employer occurs within 30 days, okay? Let's get that ball rolling. If I come to you and I say, I'm interested in working, I want to hear, hey, okay, let's talk about it. Let's talk about your work history. Let's start thinking about building a resume. Let's talk about interview practice, all the stuff that we all did to obtain the jobs that we have now. Let's get that ball rolling sooner rather than later, right? And if I am symptomatic, if I'm exhibiting, depression symptoms, right? I don't want to hear, well, Chris, we know that you're exhibiting this symptom. Why don't we wait till you're stable, right? Why don't we wait till there's a little better outlook on what you're doing every day? We need folks to hear, folks being myself and all of us as staff, that, again, employment is that key clinical intervention, right? It's one of the options on the menu for me as a client to choose that's going to help me in my recovery, okay? Employment specialists help individuals explore the world of work at a pace that is right for them, okay? So we're going to go at my pace. It might be really quick. It might be delayed. It depends on what I need, all right? But we're going to go at a rapid pace to start. We're going to start that process, but once we engage, we're going to say, okay, what do you need? Let's meet you where you're at and go from there. Okay, next slide, please. So you heard me mention this earlier to address some of the questions in the chat. Again, the employment specialist has to have some integration with the mental health treatment team, all right? And that's what this principle is. Employment specialists should be meeting at least weekly with the team of providers that are also serving the individual. If you think about it, the individual has many folks around them. Think of a circle, right? Individual in the middle, they've got their employment specialist, social worker, psychiatrist, family members, whoever else, right? The employment conversation should be that rotation among all those providers that are serving that individual, okay? This includes the care coordinators, therapists, medication providers, housing specialists. We hear a lot of questions about the interaction between work and housing, right? So they're a key player in this conversation. The team meets together regularly to plan recovery-oriented services, including those employment opportunities, right? Again, the theme here, employment is that key recovery tool, okay? Next slide. Again, you heard me mention this earlier in regards to some of the questions. Individualized time unlimited supports. Again, those are tailored to the individual's needs follow-along supports continue for as long as the individual wants and the individual needs them. Okay, there's not a cutoff. Job supports are based on the needs of the individual. Supports are in place to assist the individual with job changes, career advancement, and any training that is needed. Supports are also in place to help the person maintain their job even amid symptom management. So again, it's time unlimited. It's what does the client need? What does the individual need, right, to be successful, right? And they're probably not going to always need that maximum level of support that they needed on day one versus day 101, right? But they may need some touch base here, a couple hours a week, even an hour a week, whatever it is. Job coaching, just to check in, right? That's that time unlimited individualized support. Again, stuff you're already doing for the most part, right? You're already hitting these principles, so it's not that far of a reach to incorporate IPS into the work you're doing. So again, if I didn't say it earlier, I thank you all for continuing to do the work you're doing. You are implementing IPS, whether you know it or not. So we really appreciate everything you're doing. So let me pause because I do see questions coming in. Let's see, Carrie. So how can staff start a conversation about employment using the IPS model? And what are some recommendations for making these discussions effective? So how can staff start a conversation about employment? Carrie, are you talking about like a staff with the individual or a staff among their team of staff? That might be a little different conversation. What I would say, Carrie, to your question as a whole, is that, starting the conversation, you could say something like, employment, we know, because you're working, I'm working, we're all working right now. If we weren't working right now, what would we be doing? Right? Pretend we didn't win the lottery, okay? We might be doing something that, sitting home, doing whatever. Would we be engaging with each other right now? No, Carrie, I wouldn't be engaging with you right now, right? So there's not that opportunity to get validated. There's not that opportunity to build my work ethic, right? So I think that to start the conversation, you could utilize employment as a platform to build someone's quality of life. What does that mean? That means that if an individual wants to work today, let's not look directly at their symptoms. Let's look at the person who they are. And I'm kind of soapboxing right now, but that's where we are. Let's look at who the person is and what they want to do, right? And let's think about, even though they're dealing with A, B, and C symptoms, let's think about employment as a remedy or an intervention to those symptoms, right? We can talk more about that, Carrie. Like consider this training like chapter 1. This is a deeper conversation on how to kind of start these conversations and continue them. But if you're talking about how to have those conversations with your team of staff, it is a bit of a paradigm shift. I'm going to be honest with you, right? We have to be able to see folks who are actively symptomatic as also being able to work, right? And we have to see employment as that one of those key clinical interventions to recovery, right? So that's not going to happen overnight. We get it. We get it. But to start the conversation, I think that's where you go. It's like, let's think about Chris, right? Chris has A, B, and C going on. Should that prevent Chris from working? Because he told me the other day he really wants to work at the local golf course because he loves golf, right? Let's talk about a way to give him that opportunity, right? Let's talk about a way that getting him out of these four walls of our program might be a better way to address his mental health needs than continuing to whatever, sit in groups, right? That's the conversation. I don't want to go too deep into that, but I think that's a good way to start that that conversation is just, let's talk about employment as a roadmap to recovery, as an intervention along with medication, along with therapies, along with peer support. Let's include employment on that same level playing field. Okay. Sorry, I'm rambling now. Jennifer, anything else you wanted to add?
No, Chris, thank you. Just really, like you mentioned, the paradigm shift and, considering the principles and the history of IPS, where it started like 30 plus years ago, and where we are as an employment services system is really getting people into the community, listening to what they're saying, not separating them out, but all along recognizing, yes, they do have some challenges. And that's where these principles can be utilized to help mitigate some of those challenges and barriers. And again, all the work that you as DRCs are already doing. So thank you, Chris. No, I don't have anything additional, but if you'd like, I can share the next slide, which is going to be something close and, like you say, near and dear to DRC's heart, which is
Benefits planning.
planning.
Awesome. Yeah, before we jump into that, Lindsay had a good question here. What agencies are providing these intensive IPS supports? Is it PROS programs? So yes, Lindsay, PROS programs are part of the IPS model. ACT teams, core teams, I mean, anything, OMH as a whole has adopted the IPS principles, the IPS paradigm, because of the evidence that it's shown, right, as being a positive way to get people work, right? There's evidence that shows that it works, okay? So yes, PROS programs are using this. Any OMH program is using this. We didn't, but we worked with the CPI team, Center for Practice and Innovation team, to share IPS principles with Access VR. So we're just sharing this as a way to inform non-OMH entities that, hey, here's what we're doing, here's what we know that works, and we're not going to just do this training and then say, hey, good luck, see you later. It's how can DRCs work together with what Jennifer and I and the whole OMH team are doing, along with what Access VR is doing? How can we all work together to, continue to incorporate these IPS principles in the work we're doing? So great questions. Keep them coming. I love it. So benefits planning is something that I know DRCs do very, very well.
Excuse me, Chris.
And benefits. Oh, sure. Yeah, go ahead.
I'm
Lisa.
sorry. Yep, there's another question. It says, can you offer more examples in practice of time unlimited support, especially when customers may be seen for more than one service?
Oh, I missed these. Thank you, Lisa.
Sure.
Let me just read it myself here. Can you offer more examples in practice of time unlimited support, especially when customers see them? Yeah, so time unlimited support. Yeah, so we know that our folks may be utilizing a PROS program, maybe utilizing Access VR, maybe utilizing whatever other program is out there. Time unlimited support doesn't necessarily have to fall on one individual entity. Like, it doesn't have to fall on DRCs. It doesn't have to generally fall on Access VR, but it may. So, like, for example, if I'm a client and I'm receiving support from a DRC for benefits navigation, right? I'm working and I'm concerned about losing my Medicaid, but I'm also receiving support from a PROS program to help me navigate my mental health barriers, right? My mental health barriers are under control. I've kind of figured out a way to deal with those, but I still have questions about my benefits, right? I may continue periodically to reach out to my DRC, my local DRC, and say, hey, I got a raise and I think I'm getting a promotion. Should I be concerned about my Medicaid? What should I do, right? DRC is going to say, well, here's what you can do, right? Here's 1619B, here's another program. So it's as simple as that, right? So time unlimited support could be benefit support. Time unlimited support could be, on the flip side, let's say my benefits are all in order, but maybe I need more help on the job, right? And I'm receiving support from a DRC and from Access VR. Well, maybe me as the client, I will go to Access VR and say, hey, are you available a couple hours a week? Because during this time on the job, it gets a little stressful. I could use a little bit of job coaching there, right? Can you talk with me and my employment specialist and try to help me out there, right? That's another example of time unlimited support. It could be that for the next duration of my employment at that employer. So it's, I could give you a million examples right now, Carrie, but those are a couple, right? It's individualized to what the person needs, right? Whether it's job coaching, benefits counseling, transportation navigation, right? It's really whatever that individual needs. And I just saw your comment below, disability resource coordinator. So yeah, I think you're asking what would be the time and limited support example for DRCs. And so, that benefits navigation, that conversation about keeping your Medicaid if you get a job offer or a raise, right? What is the trial work period for folks on SSDI? That might be another conversation, right? So that's really what we're talking about with time unlimited support. Again, probably support you're already doing. Like I can attest to Mr. Banish. I see you're on the call, John. Thank you for joining. Like you and I have reached out via email many times, and I've gone to you on questions, right? That's time unlimited support for folks who are working, right? And John gives spot on support and accurate information, right? It could be as simple as that, hey, check out Medicaid buy-in program for working people with disabilities. Here's the toolkit. Here's the application, right? Here's how you keep Medicaid while you work. That's an example of time unlimited support for DRCs, okay?
Chris, could I chime in?
Of course.
Sure. So, great examples. Thank you. And I think we're going to be getting to it a little further in the presentation, but it really reinforces some of the things we're saying about what USDRCs are doing. Some of these time unlimited supports could be directly related to your integrated resource teams. So like Chris mentioned, it may not be you individually doing all of it, but really bringing together a team of support from different disciplines to support the individual in finding the employment, keeping the employment, and supporting them for as long as they need.
I just muted myself. Sorry. Yep, exactly. Thank you, Jennifer. That's it. And great segue. Before I read the slide, though, let me just honor the comments here. So Adele says, I like this approach. It capitalizes on the motivation of the job seeker. The employment specialist, DRC, or DRC is their cheerleader. Focus on the positives, and if the job seeker isn't ready, there are supports they can rely on. Assessment is an ongoing process. Adele, I thank you for saying it that way. I think that's what I was digging for earlier. Assessment is an ongoing process, except the assessment is not necessarily in-house at a desk. It's on the job in the community with supports. So awesome. Thank you, Adele, for saying that. Amanda says a sense of purpose is essential. Employment can most certainly do that. Exactly, Amanda. Thank you. Carrie says exactly what you just said, Jennifer. This is where the integrated resource team model applies. And that's what we're going to talk about in a couple slides. So perfect segue. But let me just talk about the slide. I don't think I've talked about this yet. We've been in the chat room for a minute. All right. So benefits planning is a key principle of the IPS model, right? It's things you all do as DRCs, probably daily, but it is a key component, a key principle of IPS. So employment specialists who may be certified benefits advisors can provide personalized information about Social Security, Medicaid, and other government entitlements. So, you know, SSI, SSDI, Medicaid, Medicare, TANF, housing supports, that type of thing. Referrals to local benefits advisors or DRCs are made so individuals can make informed decisions about how their benefits will be impacted when they work and whether working is right for them, okay? You all are the experts, right? You're the experts in that. It's kind of a give and take here, a flow. Like we usually send folks who have questions about benefits to our local DRCs, right? And again, we thank you for answering those very layered questions that folks have. We can provide very general overviews and, you know, offer assistance in terms of, you know, general work incentives, but it's really the work you all are doing on a daily basis, listening to folks' individual stories that makes that success possible. So again, I'm beating a dead horse there, but I thank you all for the work you're doing. And that's the point on the last bullet there. The process is individualized and, of course, maybe ongoing for as long as needed. Okay, next slide. All right, so please continue with questions. I know they're coming in. I don't see any right now, but those are the 8 principles of IPS. You all will get a copy of this material later today. Most likely I'll send it out. I want to talk about now, which we've already touched on many times, but I just want to kind of drill down a little bit. What is your role? Like, what do we see as a DRC role in IPS? These are things you already know, but the goal and the reasoning for sharing this on these slides is just to, you know, kind of tie in your body of work to IPS and to see that, again, the work you're doing every day is not even that far removed from IPS, but you're probably, again, already hitting a lot of these principles of IPS. So next slide. So what would be the DRC role? Well, it might be to connect with individuals' team of support, right? So the employment specialist, case manager, clinicians, social workers, to identify the needs of the individual, okay? That's where using those assessments, right, those more traditional clinical assessments will come in handy for the DRCs, right? Provide public benefits advisement and SSA work incentive counseling to individuals as they transition to work, okay? Helping the individuals make informed choices. And this is where the IRT comes in. So I think it was Carrie that mentioned in the chat, this is an integral part of what you do. It's also an integral part of IPS. So develop an integrated resource team, IRT, to include others who can support the individual in overcoming challenges to employment, okay? Again, that may be anyone the individual needs. It might be the social workers, the psychiatrists to help them navigate a mental health barrier, might be working with pros teams, you might be working with Access VR, you might be working with us on some level to make those connections to those providers, right? It's whatever is needed for that individual, okay? Carrie, keep in mind that the integrated resource team approach is intended to connect and coordinate service between 2 or more services. Exactly. Yep. Exactly. So again, none of this should be done on an island. That's the whole point of IPS. That's the whole point of what you all do every day, right? I don't need to tell you that, but you're all interacting and integrating with many different state systems, as are the clients, the individuals we serve, right? So if we're educated on the resources at a state level for folks, or even at a local or regional level, that's only going to benefit the individual even more as they try to navigate those different resources that they're dealing with every day. So great point, Carrie. Thank you. Okay, next slide. So what else do you all do? And we know, again, you're doing much more than these couple slides. This is a very condensed version of what you do. You may be promoting the Ticket to Work program for individuals 18 to 64 on SSI and or SSDI who want to work, but not just work, they want to work in a competitively paid, integrated environment, right? You might be conducting outreach to businesses to develop job opportunities. Again, another component, another principle of IPS, right? Job development, which again, you're already doing. You might be placing youth and adults with disabilities or who are experiencing mental health issues in those work experiences, excuse me. Again, the work itself is a intervention towards recovery, a key component of recovery. It's a recovery tool, okay? Next slide.
Here comes the fun part.
The fun part. Yeah, so again, this is not just the paradigm or principles that we think are cool. This is the evidence, right? And as I dust off my screen here, apologies, it works. And so the following few slides are IPS success stories. These are real success stories that we pulled from our colleagues at the CPI team, Center for Practice Innovation, who tracks the data on IPS success. But again, before I jump into success stories, any questions, further questions on your role, on IPS in general? Just put them in chat, unmute as needed. Please interrupt me. But let's talk about success stories. There's a couple, and they're very cool. So first success story is John. John says, I was interested in work, but I knew my mental health issues might be a barrier. With the help of my employment specialist, I was able to look for work quickly and found a job at the mall that I liked. So the principles are in parentheses, italicized in parentheses. So zero exclusion, right? My mental health issues might be a barrier. Well, no, they weren't, right? You were not excluded based on your mental health barrier, or I'm sorry, your mental health issue. Rapid job search. He was able to look for work quickly, got the ball rolling, right? Let's make a resume. Let's start looking for jobs, right? Individual preferences. John knows that he likes to work at the mall. His preferences were honored. And of course, the mall is one of the most public places you can be. So it was certainly an integrated environment and competitively employed. So that's where we're hitting those, again, IPS principles. John also says, I also shared that I was very anxious about what may happen to my SSI and Medicaid benefits when I started working. I was referred to a benefits advisor, and they told me about a way I can keep my Medicaid even if my income is too high for an SSI check. This made me feel much better, and I'm proud to say I'm still working at the mall, loving what I do. So that's where that benefits counseling, I'm going to say they're probably talking about 1619B there. That's where that comes in handy, okay? So again, IPS principles are woven into the work you're doing every day. It could be as simple as a phone call or an email with an individual who has a question about how can I keep my Medicaid if I make too much money, or I should say make more than the allowable limit for SSI. It's that simple. That's benefits counseling, right? Let me check chat.
Yeah, I was just going to say, Chris, there is a comment.
Okay, Carrie, great question. Excuse me. Please share what 1619B is for those unfamiliar. Yeah, thank you. I wasn't going to go down that path unless you asked me. So, 1619B in a nutshell is a continuing Medicaid program for folks who are receiving SSI benefits if they're making over the allowable limits to receive an SSI check. So, in other words, if I'm working and I am receiving SSI, and then I get a raise or I get a new job, and the money that I'm making is over the amount that I can make while getting an SSI check, and I lose my SSI check, I can still keep my Medicaid through 1619B. Okay, so my funding stream, if you will, went from SSI check to my job. I still keep my paycheck, and oh, by the way, I can still keep my Medicaid. And keeping my Medicaid is essential. Obviously, it's medical insurance, but it's also eligibility for housing, for voc rehab, for transportation, specialized transportation, if I meet the criteria there. So that is a very significant program for folks on SSI. That should happen automatically if the individuals on SSI are reporting their income on a monthly basis. Okay, it should just kind of trigger automatically. But again, it's on the individual and their network of support to ensure that the individual is reporting their income monthly. Okay, great question, Carrie. Thank you. That's a huge, huge need because a lot of folks on SSI are concerned about losing their Medicaid, and sometimes they don't work up to their potential for fear of losing those essential medical benefits. But through 1619B, they can keep those medical benefits and continue to increase their quality of life. So there's also Medicaid buy-in, but that's I'll just do a quick, brief overview on that. That's for folks on SSI, SSDI, or for folks who are not eligible for either one. But that will allow folks to make a substantially larger amount of money at their job and still keep their Medicaid as well. Okay. Quick plug, we do a Benefits 101 training, just an overview. So you'll have our emails if you want more information, if you want a deeper dive into what those work incentives are and those continuing Medicaid programs are, just reach out to us. Okay, so that was John. Let's talk about Amelia. So Amelia says, I always wanted to work at my local grocery store. I knew the people there, but I feared because I was dealing with depression, it wouldn't work. I spoke with my employment specialist, and he and I began making connections at the store very quickly. I put together my resume, sent it over, and started practicing for my interview. So again, IPS principles are in the parentheses, individual preferences, right? Amelia wanted to work at the grocery store. Zero exclusion. Her depression was not a barrier, right? Job development. They began making connections at the store very quickly. Rapid job search. They didn't wait. Job process started, right? Before long, I landed the job and continued to receive support when I needed it. I was offered a raise, but knew it might hurt my SSDI and Medicare. So time unlimited support, right? She continued to receive that support that she needed, and she got her questions answered about SSDI and Medicare through the benefits advisement. Amelia also says, I was connected to a local benefits advisor who told us about the trial work period and a way to continue to receive my Medicare. This was confusing at first, but through this help, I was able to take the raise and can now afford my own place. That's why we're sharing it. It's a success story, right? So competitive integrated employment, right? Benefits advisement. She got her information about trial work period and ways she can continue to receive her Medicare. So again, it's not that big of a reach to incorporate and implement the principles. Again, it's things you all do every day, okay? So that's Amelia. I think that might be it for success stories, but
It
what do we
is,
got
yeah.
on the next slide, Joe?
Yep, it moves us on to additional resources.
Okay. So resources. So IPS Works, this is a site that we reference very frequently, ipsworks.org. Center for Practice Innovations, you heard me mention those folks a couple times. We work directly with and hand in hand with them. In fact, there's a CPI webinar later today that I'm going to jump on, and that's at practiceinnovations.org. New York Employment Services System, that's us. We're the nice people, NYESS, nyess.ny.gov. Jennifer and I are the regional employment liaisons. As you know, we can help make connections to employment providers for you and really make that process of integrating among systems easier, not only for you, but the folks that you work with. So, next slide. That might be it, or
That's it, and it just kind of wraps up our contact information.